Hey everyone, just wanted to go over our work for last week. I'll talk a little bit about this week and then go over some quiz questions. So last week we really focused a lot on HIPAA. HIPAA is there are a multitude of laws and regulations that we need to follow in the healthcare setting, but HIPAA is one that's really come to the forefront over the past it was almost 20 years ago when the law was passed over 20 years ago. The regulations were put into place almost 20 years ago, and we still don't do a good job at it. So that's why I think it's worthwhile chatting a little bit about. So I look forward to looking through your assignments from last week and getting a feel for what your thoughts are on that compliance situation that we discussed. This week we're going to dig into a few different areas. There are certainly, and we're kind of going back to the ethical side. Obviously, this class is law and ethics, so we're kind of flipping back to the ethics side here a little bit. Talk a little bit about stem cell research, uses of stem cells, clinical trial ethics, which is another issue that we have, and stem cells kind of play into that. And then we actually have a discussion. Is it our discussion topic? No, it's not. No, it is our discussion. Sorry, about the death row organ donation. There's an article here about that. So we'll talk about that in the discussion topic this week in conjunction with the discussion about the John Q movie. And hopefully, maybe some of you have seen that movie. I know it's an older movie, so it's not likely that everyone has seen it. But it's really interesting to kind of take a look at these two different areas of ethics with regard to transplant. And then also we're going to talk about stem cell research in our written assignment for this week. And the one thing I will call your attention to is in the classroom, in the week 4 classroom, this is the information here about the written assignment, but you'll actually submit it down here. So this is just, unfortunately, I have a limited amount of space that I can use when I use the Turnitin assignment links. So I did put the information here, and then you'll actually submit your paper down here. So let me know if you have any questions. If there's problems with any of the links, they should all be working, but what worked yesterday may not work today, and vice versa. So please just let me know if there are any issues. So let's go over a few of the quiz questions from last week. The first one here, I'll bring this over here so I can see it. The integrity and completeness of the medical record are important in reconstructing the events surrounding an alleged negligence or criminal act in the care of a patient where the medical record, and then there are several answers here: aids police investigations, aids in determining the cause of death, provides information in work comp cases or personal injury proceedings, or all of the above are correct. And in that case, all of the above are correct. There are certainly times when we'll use medical records with regard to law enforcement, when trying to determine cause of death, for comp and personal injury cases. So it's important that the record is complete and accurate for those reasons. When you have a physician, I've unfortunately, I guess, worked in organizations where we had physicians, and you will all work in these organizations someday too if you don't already, where we have physicians and providers that are just not very good at doing their documentation in a timely manner. And I'll just give an example. I had at the one place I had worked where I was a compliance officer, we had a physician that came to my attention that had not completed their documentation for office visits for 6 months. So this physician was at that time, this is when it came to my attention, was at that time trying to recreate his documentation, all of his office notes for that 6-month period. Now, I would be willing to bet that you talk to most physicians and providers, they're going to say, I could go 2 days beyond when I saw that patient, and I'm not likely to remember exactly what I did or what I said to them, just because they see so many patients with so many different problems. So to go back and recreate for 6 months was just ridiculous, let alone any fraud and abuse implications for actually charging for those visits, which luckily the practice was not charging for the visits. But they were also losing money because they were paying a physician a full-time salary, and they weren't actually, they were seeing patients, but they weren't actually getting paid for them. So So having correct and accurate documentation, having it done in a timely manner, is crucial to for all of those uses that were talked about in there. Medical record is a legal document, and it's used for a multitude of different reasons. Next question: which of the following statements is true regarding medical record entries? So they should be written within 7 days of observing a patient's deteriorating condition. They should be written within 21 days of observing a patient's deteriorating condition. They should be legible to read, and they should not provide too much clarity. So the correct answer is that they need to be legible. Luckily, in today's world, most organizations have made the switch to the electronic medical record, which allows that legibility issue to go away. But I can say that I still actually do some audits of organizations. I do auditing still on the side. I do some audits where they are doing some forms on paper and then just uploading them to the electronic format, and legibility is still an issue amongst physician and provider documentation. So legibility is crucial, because if you can't read it, it's not documented, which means it didn't happen. Really important there. The questions or the answers here about being within 7 days, 21 days, they really should be. Our standard at our organization was 48 hours when I was there, and I think that organizations have actually even tightened up on that now, so that it's immediate, because back then they had to dictate, have it transcribed, or they had to handwrite it. Now that it's immediate and most of the documentation occurs in real time at the time of the service, that timeline has probably crunched down even more. That documentation has to be complete within X amount of hours after a visit or a service. Next question: which of the following statements is true regarding medical record entries? Oh, that's the one we just read. Sorry about that. Next one: the persistent failure to conform to a medical staff rule requiring physicians to complete records promptly can be the basis for. And there are several answers, but the correct answer is limitations placed on or suspension of the medical staff privilege. And this is. So when we have rules in any setting, we need to have some teeth to those rules. So you need to be able to, let's say the physician comes in, does documentation, does it in a timely manner, everything's great. A physician comes in, sees patients in your hospital and doesn't do their documentation. What are we going to do? The rule says that you have to, but what do you do? Most of the physicians are not working for the organization, and isn't necessarily the case here in the Pittsburgh area because of the large health systems, but in a smaller town where there's a community hospital and private physicians, they don't actually have any leverage over them as an employer would. But what they do have are rules that say, okay, if you do not complete your medical records, you can no longer see patients in this hospital, or you'll be on suspension for a certain amount of time. So it's really important that providers follow the rules, and then the organization, the medical staff, which is the group of physicians and providers that see patients in that facility, the medical staff has their own set of rules that says, okay, we agree as a medical staff that all physicians and providers will document within 48 hours. If providers are consistently not meeting those requirements, then they can be suspended, which means that their patients will not be able to come to that facility. Or if they do come to that facility, they'll need to be seen by a different physician that's on the medical staff and not suspended. So that is the answer there. I'm trying to see which. The one answer that was chosen otherwise was department director completes the records of those physicians who fail to complete them. That would be completely inappropriate. Department director could never complete records on behalf of a physician. The physician or the provider needs to do their own documentation and complete that promptly. If someone other than the provider does it, signs the provider's name, that's fraud. So we would never want that to be happening. So that's all I have this week. Obviously, like I said, we have our discussion about about the organ transplant stuff. We have a written assignment about stem cell research, and there's a really neat video up here from 60 Minutes. Very interesting. I find it very interesting. Hopefully you will as well, about some of the negative things going on with regard to stem cells and fraud. And so that's what you'll be writing about in your written assignment this week. And then we do have a quiz. We are supposed to have a check-in, a Blackboard check-in, or an online check-in this week, just meaning that kind of a live office hour where people can come and ask questions. It's not a requirement, but you're welcome to come and ask questions, etc. I'm going to push that off to next week. I have some personal illness things going on, so the evenings this week they're just not great for me. So I'm going to push it off to next week. There's no assignments related to it. It's just a time for you to come and ask questions if you have them. So I will schedule that, probably a couple sessions for next week across my classes so that students can come and ask questions if they have them. But always feel free to ask any questions you have. Drop me an email, give me a call. And we can always meet up. I can always meet up with you in the classroom if it's something where we want to look at the computer while we're chatting. And so we'll have the overall session next week sometime when hopefully things are a little more settled for me. So I guess that's it for this week. Again, any questions, please just let me know. Thanks.